Hi, this is Lola. So in this video, I am going to be addressing the benefits of postpartum pelvic floor therapy. And I'm going to be talking about why I recommend pelvic floor therapy for every postpartum mom. So number one thing is that it helped greatly with my pain. So with me, I had my baby. I had to with my baby. I had to have an emergency C-section, and so with that came a lot of troubles. I had bleeding at the site when I got home. They were considering sending me back to the hospital. I was in a lot of pain just from the surgery. I initially wasn't taking any narcotics because I was worried about how it was going to affect the baby. But then I took it in order to cope so that way I'll be able to take care of my baby. So I just had a lot of pain, and just from being in labor for such a long time before I had a C-section, I just had a lot of pain, and so I would say that my pain level was on a scale of 7 to 8 out of 10. And my pain was on my abdominal muscle area, and it was also in my pelvic floor region, and that was where I was having the most pain. Every time I would bend or try to pick something up or squat or something like that, I would have all this pain. And so when I started the therapy, I could barely do any of the exercises. I was doing body weight only and barely able to even do that. But after I started the therapy, I got stronger. They were, massaging my belly, massaging my C-section scar. And I would say today, I've been doing the therapy for like 2.5 months now. And today, my pain is virtually nothing. It's like 0 to 1 out of 10, and I feel much stronger and much better. So number one thing that it helped me with is my pain level. My energy level also increased. I was into strength training before I was pregnant, and throughout my pregnancy I was doing strength training exercises or just like low impact exercises just to keep my body moving. And so in the postpartum season, I did not have as much energy, obviously. But after I started doing the therapy, I started getting my energy back. I started feeling stronger. I started feeling less pain, and I was able to I was just happier in general. I was not as dependent on my husband to help me with things around the house or just in general. And I was able to help my baby better. I was able to, before I started the therapy, I was carrying my baby in the carrier for about maybe like an hour and a half to 2 hours, and I would have this back pain after. But now I'm able to carry her for much longer and be able to cook, clean, and do stuff around the house. So that's another benefit. My mood was also better. And then another really good thing was that with the physical therapy, they would do like an assessment on whether you have diastasis recti, and they will measure how wide it is. And as you progress through your therapy, they will keep measuring to see if it's closing up and all that. So that's also another added benefit. You can have a professional really measure how bad it is, and to see if it's getting better, what you should be doing, and all this kind of stuff. So those are the benefits. There are many other benefits, but those are the ones that I could just think of off the top of my head as I was writing this down. So that's that. Next, I'm going to address the concerns that I had when I started, and concerns that my friends have told me about when I've tried to talk to them about doing pelvic floor therapy. So number one is how invasive it is. Some people are not comfortable about how invasive it is. So I'm going to just speak based on my own personal experience. I am currently going to Spooner Therapy, and I don't know if they're all over America, but I know they have locations all over Arizona, and they have, in some of the locations, they have certified pelvic floor therapists, and all the ones that I've spoken to so far are women. And so when you go to get yourself checked, you're not having to deal with a guy checking, doing an internal assessment on you. And so I don't think that that's something that you should worry about, because if you're comfortable having OBGYN check your cervix and check how dilated you are, or if you're comfortable with a midwife checking you, then I don't see how that would be any different from having a female pelvic floor therapist check you. So and also for me, they've only internally checked me once, which was my initial assessment. Every time that I've gone into the private room to be checked, they just do like the belly massage to help with the diastatic stress recti, and also they do this massaging of the scarring. So so they do one internal assessment at your first visit, and then they also do another assessment when you get discharged from the therapy. So another concern that I've heard of is flexibility. I'm a new mom. I'm a stay-at-home mom, and I'm not really into like paying for like babysitters to watch my baby. I am okay with some trusted friends watching my baby. I do not have my family here in Arizona, and so the way I did it was I went for my initial assessment. The good thing about Spooner therapy is that they're very, very welcoming to moms, and they understand that moms are not going to always have people to like watch their baby. So they are open to you bringing your baby and doing the exercises with your baby on you, or you can have your baby in a stroller while you're doing your exercises. One of the therapy aides can, push your baby, rock your baby back and forth and all that stuff. They work with you, is what I'm trying to say. So don't just think that there's no way you can do this. There are many options that you can, that you have if you talk to your therapist and talk to them about your concerns and your limitations and all that stuff. So that's one aspect. So when I went for my initial evaluation, my therapist told me that she was recommending 2 visits a week. Each visit takes about an hour to an hour and a half for you to finish the exercises, but 2 visits a week for 6 weeks was what she recommended, but for as long as my insurance would pay is what she said I should do. But 6 weeks, and if my insurance is going to pay for more visits, then if I can benefit, I'll do it, right? And so that's what I did. So what I did was that so 1 visit a week, I had a friend that was willing to watch my baby for me at the physical therapy location. She comes once a week, to watch my baby at the physical therapy place while I'm doing my therapy. And then the other visit, I was able to work with my husband to where he's willing to watch the baby for me as well once a week while I go for my physical therapy. Now, throughout the whole time, I've had cancellations. So like my friend has canceled on me a couple of times, and my husband has also had to cancel on me due to work reasons. And so during that time, I just took my baby to the place. I didn't have to cancel my appointment, and I told them what was going on. So they had me have my baby in the carrier, and they adjusted my exercises so that way I could do the exercise while having the baby with me. And you would be surprised what would happen. Sometimes I would just take the baby in the stroller, and then she would just fall asleep the entire time at the physical therapy place. And so that that has worked out like that sometimes, but it's never, and it's better for you to go and do less than not to go at all. That's my opinion, because you still get benefits from just doing anything, so that's also something to think about. Also, another thing is that when I first started, I thought that I had to make my appointments for the times that the pelvic floor therapists were there, but they have regular therapists and then they have pelvic floor therapists as well. But then I've learned just by going there that you don't necessarily have to always schedule your appointment when the pelvic floor therapists are there. So you can just schedule your appointments, your internal evaluation appointments for when your pelvic floor therapist is there, and then you can do the exercises that is recommended by the pelvic floor therapist with any therapist. Whether it's a guy or a girl, it's in an open area, so you don't have to worry about, being faced with some kind of inappropriate, guy or situation or anything like that. It's going to be in an open area, in where there's accountability, and you don't have to worry about safety as much. So yeah, so those are things that you can think about when you think about trying to do this. Let's see here. Yeah, so I addressed all that. So now I'm going to move on to if you're thinking about doing pelvic floor therapy, these are just like bullet points, steps that you should take before you start. And the number one thing that I think you should do is that in your, I would say, prenatal season, when your insurance company is already, when you, at the time that you notify your insurance company that you're pregnant, and you start doing your prenatal visits with your midwife or your healthcare professional, your OBGYN, you want to talk to your insurance company about what your policy is in regards to pelvic floor therapy. How many visits are they willing to pay for? Some insurance companies are willing to pay for 22 visits, while others are willing to pay for 45 visits. So you need to check that. Some people may say, oh, I don't have insurance. I have a health sharing community. A lot of health sharing communities like Good Samaritan Ministries or CHM Christian Health Ministries are also willing. They also have plans for their clients, and so they will pay for your therapy visits as well. So call your insurance company and see what they can cover for you. Once you know that information, then you want to voice that information to your midwife or your healthcare professional throughout the prenatal throughout the times that you go for your prenatal visit. You can do this as well during the postpartum season, but postpartum season is a very difficult time for your mom. You're foggy, you're tired, you're in pain, you're emotional, and all these things. So you may not think about it or remember to ask them during the season. So I think it's better for you to ask them during the prenatal time. But if it's during the postpartum season that you remember this, that's fine as well. So when you talk to your healthcare professional about this, you want them to write the prescription for you for the postpartum season, for like a therapy company. So in Arizona that we live in, I know there's Spooner Physical Therapy. They have Banner Therapy, Physical Therapy as well. I went with Spooner because that's just what my midwife recommended. And that's what she signed me up for. So you make sure that they write a prescription and forward the prescription to the therapy place. Okay. Now, you also want to find out from your insurance company, like how soon or how late after you have the baby can you start the therapy to where they will still cover the therapy visits. So I have a friend, for instance, who was interested in doing pelvic floor therapy, but she was calling the insurance company, or she was looking into it 6 months postpartum. By that time, the insurance company is not going to pay anymore. They're going to have to treat it as a new event. So you're going to have to pay a deductible and all that before they're able to cover anything for you. I hope I'm making myself clear. So you want to know. So for my company, I have CHM, Christian Health Ministries. So long as you start the therapy within 3 months of postpartum season, they will cover that. So you want to make sure that you start during that time before 3 months is over. I'm sorry, so the video stopped recording for some reason, and I don't know where I left off, but you just want to talk to your healthcare professional. You want to talk to either your midwife or your OBGYN, and you want to have them get you the prescription, and you want to make sure that that prescription is submitted to the physical therapy company that you're going to use. And then you want to make sure that you start your therapy before it's too late to where your insurance company is not going to pay for the visits anymore. I started therapy 2 months after 2 months postpartum. You also want to make sure that you're medically cleared from your OBGYN or your midwife before you start the therapy. But so once you go for your 6-week visits, if they clear you for physical therapy, or if they clear you for activity in general, then you can start therapy. And so yeah. And if you live in Arizona, if you're watching this video and you live in Arizona, I like spooner therapy a lot. I've had like bodily injuries in the past, and I've had to do therapy with Banner, and I've also had to do therapy with Spooner therapy. And I would say there are benefits, pros and cons to both sides. They're both great companies. However, I would say, just with my experience with Spooner therapy, I like Spooner therapy better because they have, per physical therapist, they have way many more therapy aids. And so because of that, the physical therapists are able to focus on the patient and focus on your evaluation, assessment, and they can evaluate easier and better whether you're doing better, adjusting your exercises to making your exercises harder or easier depending on how you're feeling and all that stuff. Whereas with Banner, they have less therapy aids for each physical therapist. Each physical therapist has less therapy aids, so they're kind of just pulled in so many directions, and it's not as easy for them to focus on the patient as much. Also, they're very, very like strict as to when you have to finish your therapy. So it's like, yeah, 1 hour you gotta finish. But with Spooner, sometimes I end up finishing my therapy exercises like it takes me like 1 hour and 15 minutes to 1 hour and 30 minutes. So I like that. I like the flexibility of being able to go at my own pace and finishing when I can. But also, depending on the therapy location, the Spooner therapy location that you go and how busy it is, you may not have that liberty or that luxury. But generally speaking, you can if they don't have that many people at that time. So yeah, if you have any questions, please just email me. My contact info is in my bio. So email me if you have any questions. If I can answer you, if I have the time, and if I can answer you, I will try to make time to respond to you. But yeah, so I hope that this video is beneficial to you, and I wish you the best in your postpartum journey. And God bless you. Have a nice day.